When I first started doing enhanced recovery, sometimes after going to a meeting, it felt like walking through treacle or mud when I got back home to try to piece things together and figure out how to make things work and make some sense of all this information I was getting. So I've tried to put a frame around this to maybe give you some ideas about how you can think about how ERAS might work in your institution. So as Ole has said, enhanced recovery after surgery is multimodal, different ways of looking after patients. It's interdisciplinary. And I really want to emphasize that, just as Ole did, about having all the participants, all the folks who look after patients in the same room so we can learn from each other. So we're addressing several factors, the factors that make a patient. IV access for fluids, maybe for nutrition, lack of mobility because they're in pain, and potential for postoperative complications. But by doing this, as Ole has said, we have better patient outcomes. A nice downstream effect of that in many systems is a shorter hospital stay, fewer complications, reduced costs, and improved teamwork. Now, as I said, when I first started doing this, it all seemed so complicated. These were the first set of colorectal guidelines, and you can see all the different components. And you can break it out in different ways. This, again, is similar to what you saw in the last presentation. And it seems overwhelming. But maybe you can break it out like this. Pre-op in this top right corner, intra-op at the bottom, post-operative, and try to assign responsibility. But that still seems complicated. So let's try and make it less complicated. So I want you to just take a look at this. You should have a sheet like this. If you don't have one, there are more at the desk outside. And reminiscent of your childhood, or if you have young kids, when you go to a restaurant with paper instead of a tablecloth, you should have a little pack of crayons. And what I want you to do as you go through the day is start seeing how you can fill these out. Green is for things you're already doing. Yellow is things you think, well, we could do that if we got folks together and did it. And red is for things you absolutely won't do. So I'll go into this in more depth in the next talk, but I just want to make sure that you actually have those. And as you go through, you check off more of the boxes green as you work your way through the process. So the way I like to look at enhanced recovery is in terms of pillars.